Hi everyone and welcome to my Capstone Project Defense presentation. The title of my project is Occupational Therapy During a Pandemic, Impact of OT on Care of COVID-19. I would like to begin by taking the time to acknowledge a couple of key persons that supported the development and execution of my capstone. I would like to thank the program director Linda Olson, the doctoral capstone director Paula Costello, my academic mentor Stephen Taylor, my capstone faculty mentor Rebecca Ozelli, my site administrator supervisor Adam Stewart, and my clinical expert mentor Cassandra Jackson. My capstone would not have been able to be completed without the continuous support and assistance that you were able to provide. The site that my capstone project took place was Rush University Medical Center in the acute care setting. It is a large academic hospital in the Midwest. The population that this research was completed on was hospitalized COVID-19 patients that received occupational therapy services during the pandemic in April 2020. Occupational therapy has had a vital role in the treatment of COVID-19 patients since the initial outbreak in the pandemic, when there was a large influx of critically ill patients infected with the virus. This included being members of prone positioning teams, actively evaluating and treating COVID-19 patients to support a return to home, as well as having a vital role in discharge planning. At this site, the two most common places that patients who were infected with the virus would be placed on were the COVID step-down unit in the atrium, or if they had more severe oxygen needs or critically ill, be placed in the medical ICU for closer monitoring. The novel COVID-19 virus has rapidly spread across the world, which created a great deal of pressure and challenges for healthcare workers on the front lines to adjust and adapt their procedures rapidly to combat the effects of the virus. The problem statement that this capstone project was formulated around looking at addressing the following. Due to the novelty of the virus, there has been limited research evaluating the role and outcomes of occupational therapy on the care of COVID-19 patients. COVID-19 can result in many medical complications, including sepsis, multi-organ failure, acute respiratory distress syndrome, and require mechanical ventilation. Another form of treatment that is done for improving ventilation is placing patients into the prone position where OTs were members on these teams. Recent research details COVID-19 survivors' post-acute rehabilitation needs, including the incidence of post-ICU syndrome, as well as the increased rate of long haulers, those still affected by the effects of COVID-19. In addition to the physical impairments, there is an increase of psychosocial difficulties, including anxiety, depression, PTSD, sleeping difficulty, or cognitive loss, which can affect 70 to 100% of patients at discharge and 46 to 80% 1 year post-acute. Occupational therapists in the hospital setting are a part of the interdisciplinary teams that work to improve the outcomes of those who are infected with the virus, including historically maintaining a role on the care of those who are in severe or critical condition. One study examined the 30-day readmission rates at a hospital and found that occupational therapy is the only spending category in treatment of patients with heart failure, pneumonia, or acute myocardial infarction that has statistically significant association with lower readmission. In a scoping review of 122 articles on occupational therapy's role in the ICU, it found that OTs can assist with decreasing hospital length of stay, risk of readmission, and overall save hospital costs. There is currently a second crisis emerging with the rising number of those recovered from COVID-19 that are managing a high disability burden that is impacting quality of life, ability to return to work, engagement in ADLs, in addition to family members acquiring new caregiver roles. The theory that grounded this project is the Person, Environment, Occupation, and Performance Model, or PEOP. This was used to guide this project as it looks at the impact that OT had on the outcomes of those recovering from COVID-19 and how therapists were able to create client-centered plans that considered the interaction between the person, environment, and occupation as a whole to enhance occupation performance and create a best fit to optimize patient outcomes. This study hopes to provide evidence how therapists are able to identify factors that hinder an individual's ability to participate in meaningful activities and promote or support success. The significance of this project is that the results hope to provide evidence demonstrating the distinct role and impact that occupational therapy has on improving the functional outcomes of COVID-19 patients. This includes making a positive impact on areas such as decreasing caregiver burden, improving functional independence, improving quality of life, and decreasing the risk of disability or readmission. As more research is coming out about the lingering effects that COVID-19 has on individuals, as well as the secondary complications of long-term hospital stays, it's important to provide evidence for the post-acute rehabilitation needs of this population. The results from the study hope to promote early and frequent OT services in the acute care setting for those who are infected with COVID-19, as well as demonstrate the vital role of OTs on interdisciplinary teams. This study aimed to determine the role and impact that skilled occupational therapy services have on the treatment and outcome of those who entered the hospital with COVID-19. My research question that formulated my project was, what was the impact of occupational therapy services on the outcomes of COVID-19 patients? This study was a retrospective study designed looking at medical charts of discharged patients with a diagnosis of COVID-19 during 2020 and were concurrently receiving OT services, including 62 patients. Exclusion criteria for this study was any patient that was designated as COVID PUI, patient under investigation for having COVID-19 during their hospital length of stay, or those who were not treated for the infection of COVID as their primary diagnosis. No identifying information was collected. Data points collected from each medical record included demographic information, age, gender, race, ethnicity, BMI, zip code, insurance provider, quality indicator or QI scores at evaluation and discharge, discharge placement, length of stay, number of skilled OT visits, intensity of OT services, which was measured as total billed units, number of billable units for each CPT code, i.e., self-care, therapeutic activities, therapeutic exercise, functional cognition, and neuromuscular education, if the patient underwent proning, was vented, or stayed in the ICU and the ICU length of stay. Data was analyzing using IBM SPSS statistics. Descriptive statistics were analyzed on each of the outcome variables on all demographics of the population. A non-parametric Wilcoxon sign rank test was performed to compare the difference in QI scores at evaluation to discharge to determine impact of OT services with levels of functional independence upon discharge. A non-parametric Spearman's correlation analysis was conducted between the intensity of OT services and number of visits to the outcome variables of length of stay, discharge placement, including if they required additional post-acute rehab or returned home with no further OT needs, valuation complexity, and discharge QI scores. These correlation analyses were performed to determine the significance that interventions had on the outcomes of those who were hospitalized from COVID-19. A chi-square analysis was conducted to determine if there was a significant difference between those who stayed in the ICU and required additional post-acute rehab. The descriptive statistics of the data analysis for demographic outcomes are depicted in the table above. A brief summary of the results included the mean age was 64.13, average BMI of 25.9, average length of stay was 15.23 days. Then there was dispersed variability with discharge placements, race, gender, and ethnicity. Median intensity of 6 units, median number of visits was 4, and majority of interventions were billed under self-care with 55.2%. The results indicated that the QI scores at discharge were significantly higher than QI scores at evaluation for the following domains following OT services: eating, upper and lower extremity dressing, footwear management, toilet hygiene, toilet transfer, bathing, and bed mobility, all corresponding to medium to large effect sizes. The only category with no significant changes was oral hygiene. The results indicated that there was no significant difference between those who stayed in the ICU and received OT services to requiring additional rehab upon discharge or returning back home with no additional OT. The following domains of occupational participation were found to be significant when examining the correlation between number of visits to discharge QI scores: eating, oral hygiene, upper and lower extremity dressing, toilet hygiene, and all ranging from a small to medium effect size. When examining the relationship between intensity to discharge QI scores, the following two were found to be significant: eating and lower extremity dressing with a small effect size. There was a statistically significant positive relationship found with increased frequency and intensity of OT services to those who were discharged to inpatient rehab following their post-acute stay. In support of this as well, there is a significant positive relationship to patients who were evaluated as high complexity upon evaluation that were discharged to inpatient rehab. There is a significant negative relationship to those who were discharged home with no additional therapy to those who were evaluated as low complexity. Results of this study are consistent with the literature by demonstrating that occupational therapists are able to facilitate increased independence in basic ADLs for COVID-19 patients, which may result in decreased levels of caregiver burden, reduced need for more intensive rehab, decreased hospital readmission, and overall increase of quality of life by promoting return to prior level of independence. It is important to note that while this study did not compare the QI scores of patients with a diagnosis of COVID-19 that received OT services to those who did not, the impact of natural recovery is unknown as it applies to the QI scores. When making a discharge recommendation, OTs holistically look at the patient, taking into consideration a patient's diagnosis and prognosis, hospital course, demographic factors, and home environment. The results indicated that those who were evaluated as high complexity were discharged to inpatient rehab, as well as having increased OT services in the acute care setting. Those who were more critically ill received more therapy while in the hospital to restore a prior level of function, as well as were advocated to receive more intensive rehab post-acute stay. During April of 2020, in the height of the pandemic, OTs were a member of the interdisciplinary teams making many critical decisions about the service distribution, triage and care, and participating in the discharge planning for this novel population that mass infiltrated the hospital system. Several limitations should be considered with this study. A future study examining the outcomes of patients that did and did not receive OT services would be beneficial to understand the definitive impact of OT on this population. Increasing the number of patients and variability in types of hospitals would be warranted to ensure validity. Treatment of COVID-19 patients implicated the following for occupational therapy practices. OTs can holistically look at a patient, including predictive factors such as demographic information and hospital course, to advocate for their needs, including post-acute rehabilitation. OTs are able to implement client-centered, safe, and appropriate interventions for critically ill patients to improve functional independence. Advocating for early and frequent implementation of OT services can improve patient quality of life, reduce risk of disability, or decrease risk of hospital readmission. This research laid the groundwork for future research to be done on analyzing further evidence-based interventions with this specialized population to further promote the distinct value of OT, including looking at the impact across the continuum of care. In conclusion, the problem statement that focused this Capstone study was due to the novelty of the COVID-19 virus, which heavily impacted the hospital system. There has been limited research on the impact and role of OT on the care of COVID-19 patients, including their post-acute rehabilitation needs. This study was a retrospective data analysis looking at the outcomes of those who were hospitalized with COVID-19 in April 2020 and received OT services. The results of this study provided preliminary evidence that OTs are a contributing factor to improving outcomes of those recovering from COVID-19, including achieving a higher level of independence at discharge, as well as making appropriate discharge recommendations based off of other predictive factors through holistically looking at the patient. It is vital that all healthcare providers are aware of the lingering effects and post-recovery symptoms of COVID-19 patients to decrease the risk of a new wave of hospital readmissions or drastic increases in the rate of disability. OTs are ideally trained with a unique skill set that allows them to have a vital role and impact on addressing the acute and post-acute needs for this unique and novel population. After completion of this project, I learned a lot of lessons both professionally and personally. In terms of COVID patients, I learned that there is so much yet to learn about the outcomes and rehabilitation needs of those who are hospitalized with the virus. I learned that there are many factors that are taken into consideration when discharge planning for these patients, and that OTs have a vital role in interdisciplinary teams with this. Personally, after completing the Capstone experience and project, I was able to grow with much more confidence with my skills, especially with treatment of those who are critically ill. After this entire process and seeing the value and impact of presenting this research, I want to continue pursuing a passion in research. I discovered that my passion and interest is truly with helping those who are critically ill, and I am confident that everything that I have learned during this experience will support me. Thank you for listening to my presentation on my Capstone project, Occupational Therapy During a Pandemic, Impact of OT on Care of COVID-19, and this concludes my Capstone oral defense.